Premarital fertility testing. A quick update. Today, we are noticing a lot of divorces happening very quickly. Women have, in general, become very, very aggressive, especially in a developing country like India. They've become very aggressive to the point divorces are being initiated as early as a day after marriage, 3 days or 1 week after the marriage. The personal laws are being utilized for a quick divorce. And we see a lot of divorced women coming into the marriage marketplace. You have divorces being initiated within a day, within a week, within a month, within 3 months, 6 months. So the general tolerance has become very, very low. And the common reasons for a quick divorce post-marriage, some of them may be very, very genuine, where the partner may be very abusive, where the partner may be an alcoholic, may be a drug addict. But there are genuine reasons for that. In a certain proportion of cases, or may I say a large proportion of cases, it seems to rise from a lack of sexual satisfaction. The male patients are commonly and very commonly being blamed for erectile dysfunction. And women say that they're not satisfied in the marriage, and that means the male patient or the husband on the other side has premature ejaculation. Sometimes there is a non-consummation of the marriage, and the male patient is blamed again, stating that he's impotent and he's a patient of ED. So here, premarital fertility tests have become useful as a tool, because to some extent, the male patient or the husband who's going to plan for the marriage the groom can technically analyze and check his health once before entering a marital contract. So remember, it's very important not to over-test in this juncture, because if you go to the commercial laboratories and you take up these men's health packages, there are a lot of extra tests that are bundled into the packages, and also we see a lot of extra scans are being needlessly written for the patients. Here, I would ask you to defer from testing. Please don't do extra tests. It's not required. And also, many a time we see patients run and do a semen analysis in these premarital fertility tests. That's also not required. What are the tests that you should do generally for a premarital fertility assessment? Is usually only your male sex hormones, which is probably tests like FSH, LH, total testosterone, estrogen, prolactin, and probably thyroid. That's all that's required. TSH. Beyond this, is any other testing required for a young male? No, usually no. It's always better in the context of a premarital fertility test to go visit an andrologist. An andrologist is someone who specializes in male reproductive health. Visit, do the testing, and also get a physical examination done. That's very important. The testis size has to be measured. The penis size has to be measured. The length and girth has to be measured. And a lot of clinical information can come from that. Blindly going to a lab, a commercial lab, looking at the package and doing the tests will make you get inaccurate information. You will be paying a lot for a lot of unwanted tests, a lot of extra tests, and scans are generally not required because that's also bundled into the package. So that's how you kind of resolve this issue. And today, because we're seeing an exponential increase in divorce and the number of divorce cases which are probably registered and going by a court, or divorces that are finished through the personal laws, and also today because marriage is generally not that easy as it seems, there's also a decrease in the marriage certificate registration rates. That is, the number of new marriages that are happening year on year are also decreasing, because on one side we have women's expectation going up significantly, and the other side, men are also struggling to get a prospective bride. It's a shared difficulty among many men, unfortunately, because the expectations are very high and the expectations cannot be met all the time. And because the influence of movies, influencers on Insta, and the lifestyle chase, everyone is chasing a lifestyle, right? People don't want that healthy normal life. People want fancy lifestyles. A lot of problems are coming, and then there's always a general lack of satisfaction or dissatisfaction, and there's the blame game, right? You easily blame your husband, you easily blame your male partner for everything. So men should be cautious and aware, be very careful who you are marrying. At the same time, protect yourself. These premarital fertility tests will also protect you should a lawsuit come on you, should you get an advocate notice post marriage stating that you're impotent. So they're very, very useful tools. But today, that's the first tool that women tend to use or utilize against men when they're exiting the marriage. I'm not saying all women do that. There are some psychopathic women who do that. They first blame, because the good woman, if she doesn't, you say her that you don't want to live in the marriage, you tell her, or she doesn't want to, but generally very decently they'll go away. They'll go with the mutual consent divorce, or they'll use the personal laws to kind of finish it off within the families in a very dignified manner. But then the women who are very, very angry and who feel like they've been cheated, or they feel extraordinarily cheated because of a marriage, some personality disorders, they may have some personality disorders, they may have female antisocial behavioral traits within them, and for various reasons, right? Human beings are complex creatures, so there's no way for you to know that. To some extent, you can sense it before marriage, but it actually happens only when you tie the knot and you live with that person for 3 to 4 months. There, these reports will protect you, because ultimately, when you have a premarital fertility test done, you can say or state to the opposite party that your hormones are intact, that there's nothing wrong with you from a potency viewpoint, there's nothing wrong with you from a sexual fitness viewpoint, there's nothing wrong with you from a fertility viewpoint. They're very, very useful. So hope you like the video. Please share this video with your friends. Put in your comments below. Please like the channel. I'll see you more with similar such videos. And this is Dr. Shah signing off for now.